Well, as we heard from meteorologist Ben Terry just moments ago, allergy season is in full swing for our area, and for many of us that can mean a lot of sneezing and itchy eyes and just feeling miserable. But just when is it that you should visit a specialist for some relief, and what can you do at home to minimize the impact of your allergies? We've got an expert here to help us out, ENT Bridget LOEHN with Lake Area Medical Center, and we are all suffering right now. Everywhere you go, you're hearing people sneezing and sniffling and just feeling bad.
Yes, right now that it's been terrible. My office has been packed with patients coming in with allergy complaints. The pollen levels have been very high this season, and patients are coming in and having lots of allergy complaints.
Well, how do you know whenever it's a problem with an allergen and not just something that's kind of going around with people, like a cold?
A lot of times it's the timing. If it's been going on for a couple of weeks, if you're not running any fever, if you're not having any color drainage, a lot of times that's when it's due to allergies.
All right, so when everything's clear coming out of your nose, that might be an allergy rather than something that's more indicative of an infection.
Correct.
Okay. What kind of allergies are you seeing right now, other than the itchy eyes and the sneezing?
Well, a lot of patients are coming in with just a lot of drainage, a lot of congestion, and the common complaints you were talking about, the itchy, watery eyes and the nasal congestion. Right now, the tree pollens are very high, and that's what's going around right now, and the live oak is very high.
What's the best thing that we can do to treat all of that? I know that my son has allergies. He takes Claritin every day. Mm-hmm. Is it all just over-the-counter stuff? Is there stuff that we can do at home to minimize that impact?
Yes. A lot of the over-the-counter medicines will work for a lot of people. A lot of the antihistamines. They have some nasal steroids that are over-the-counter now. A lot of people can do better with avoidance. They can make their allergies a little bit better. Sometimes that's easier said than done.
Yeah, how do we do that? How do we do that around here?
A lot of times you can do hyperallergenic dust covers,
Okay.
but with the pollens, a lot of times it's difficult to avoid them.
All right.
And that's when you need to be either on over-the-counter allergy medicines, and if those aren't working, that's when it's time to see a specialist, and we can put you on prescription medications.
Okay, because we are carrying those allergens into our homes with us on our clothing and our things that we bring inside. So then it's contaminating our houses as well.
Correct. And it's on pets. And
okay. Good to note that, so we can get rid of your pets if you've got those allergies. No, I'm just kidding. When should somebody come in and see you about their allergies?
If they're having problems with allergies and it's bothering them, that's when we see a lot of patients for allergies. If they've tried over-the-counter medications and they're not effective, we can also see them and see what we can do to improve their symptoms.
And what are some of the treatments that you guys offer for allergies?
We have prescription allergy medicines that we can use that are a little bit stronger than just the over-the-counter medications. There are different classes of medications, different nasal steroids, different oral medications we can use. And then also we can test patients for allergies and figure out what it is that they're allergic to. And from there, based off of their results, we can put them on allergy therapy, which are allergy shots in order to improve the immune system against the allergens.
Helping us all feel better
Yes.
this season with those allergies. Thanks so much for coming by and talking to us.
Thank you
about
very
it.
much.
All right.